to everybody who's joined in. Hello, a very good evening to everybody who's joined in. This is Dr. Chitra, endocrinologist, Associate Professor, Ramaiah Medical College, Bangalore, and I'm here on International Women's Month to embrace equity, to talk about endocrine aspects of women's health, because as we all know, certain endocrine conditions are more common in women. So by embracing equity, we utilize every opportunity that there is to speak about the endocrine conditions, raise endocrine awareness so that we can detect the endocrine conditions, prevent the endocrine conditions, and live well with endocrine conditions. So the question box is open for you to land your questions. I'm going to try and keep my session short, briefly touching about all the important endocrine aspects of women's health. I think the most common condition that everybody has questions about and wants to talk about are thyroid conditions. Thyroid conditions are more likely to occur in women in the ratio of 1:9. So for every man who's detected with thyroid condition, there are close to 9 women who are living with thyroid conditions. And one of the reasons is the fact that we are more predisposed to autoimmune conditions. The most common cause for thyroid conditions is autoimmunity. If I can explain autoimmunity in a sentence or two, we all have an army in our body whose job is to fight viruses and bacteria from the outside world. But sometimes there's a virus or a bacteria which looks exactly like one of your organs. In this situation, it happens to be the thyroid. So your army is making antibodies against the virus, suddenly gets confused and starts making antibodies against your thyroid gland, making it difficult for your thyroid gland to do its job. The job of the thyroid gland is to produce two very important hormones called T3 and T4. These hormones are essential for functioning of various aspects of our health, including having regular cycles, mood levels being up, energy levels being up, muscles being supple and active, our intestines working well, our hearts working well, our pulse and blood pressure rates working well, hair and skin working well. So if there is for some reason an autoimmune event which happens, which is more likely to occur, especially after the COVID infections, we are seeing a surge in autoimmune conditions. We are also likely to see a surge in autoimmune conditions after puberty, after pregnancy. So those are situations where you should watch out for features of hypothyroidism, and it's a very simple test to detect this condition, and the solution is to replace the hormone which your thyroid gland is struggling. It's also important to pay attention to thyroid functions in, let us say, children who are not gaining weight according to their age as compared to their peers. That's also one situation where you can consider thyroid dysfunction. Another dysfunction or a situation would be where you're having excessive bleeding or irregular menstruation, or maybe large cysts in your ovaries. That could also sometimes be because of untreated, undetected hypothyroidism. So who should check for a thyroid function and how often should you check? If you have a family member with a thyroid condition, you should probably be careful and get a test done once a year as part of your annual health checkup. That's one way to go about it. And also at your vulnerable periods. A vulnerable period means maybe when you are planning a pregnancy, maybe right after a pregnancy, maybe around menopause. So those are all important junctions where you should consider doing a thyroid test. The second type of thyroid condition is where your thyroid gland is hyperfunctioning. Strangely, the cause for this also is autoimmunity, antibodies produced against your thyroid, just that in this situation the antibodies are pressing the switch on the thyroid gland, which increases production of thyroid hormones, right? And this is usually a dramatic presentation, and you're likely to have symptoms which bring you to a doctor much more likely than hypothyroidism, where your thyroid gland is under functioning. So features of hyperthyroidism, where your thyroid gland is functioning excessively, will be weight loss, feeling of tiredness, increased heartbeat, tremors in your hands, again irregular periods, or excessive bleeding. All of these are features. Again, this also is more likely to occur maybe right after a pregnancy, and through your reproductive age as well. Any kind of thyroid condition is easily treatable, and you can live well, whether it be with hypo or hyperthyroidism. There are a lot of myths about hyperthyroidism in women, that it will affect fertility, that it will affect your well-being, it will lead to continued weight gain. Much of it is unfounded fear. It is a very easy condition to treat. You should seek the help of an endocrinologist and be able to be absolutely healthy with hypo or hyperthyroidism. The next, probably most common endocrine condition in women is polycystic ovary syndrome, and everybody is talking about it. More and more young women are being diagnosed with it, or even self-diagnosing themselves with it. It is a condition which is caused due to multiple factors, some genetic and some environmental. The genetic factors are, if you have a family history of, let us say, diabetes, hypertension, heart disease, you are probably at risk for PCOS, because the mechanisms for diabetes, PCOS, hypertension, and heart disease are pretty much the same. So in this, you usually have 2 out of these 3 symptoms. One would be irregular cycles, where your cycles are happening late. The second would be either increased pimples on your face or increased hair growth on your body or face. And the third would be appearance of a certain number of cysts in your ovaries, either one-sided or both-sided, with an increase in size of your ovaries. So these are common manifestations of PCOS. Not all women will have all 3. You might have some women who just have irregular periods and pimples, some women who just have the ultrasound features and maybe in irregular periods and not have the acne. But if you have 2 out of the 3, we make a diagnosis of PCOS. Why is this important to recognize? Primarily because, like I said, the soil is the same for PCOS and for, let us say, diabetes or heart disease. So women who have PCOS in their 20s are more susceptible to diabetes in the future, also maybe diabetes during pregnancy. Apart from that, the acne and hair growth itself is sometimes very difficult to deal with. It affects the appearance, it can affect the self-confidence, body image of the women, which can interfere with their overall well-being and emotional health. The irregular periods could get in the way of conception or having children, and also sometimes, if you're not having cycles for 3 or 4 months at a stretch, increase the risk of a rare form of malignancy called endometrial cancer. So for these reasons, it's important to identify this condition. Much of PCOS can be managed by sustained efforts towards lifestyle changes. Sometimes you might need to go on medications temporarily for regularizing cycles, for improving acne and hair growth. And sometimes you might need to screen annually for diabetes and cholesterol. This might be true for even women without PCOS or even men without any of these conditions, because we are all at risk for these metabolic conditions, primarily because of our lifestyle. So if you're having irregular cycles or acne or hirsutism, speak to your doctor to identify the cause. There are many conditions which can look like PCOS. So if we identify them and treat them, maybe the PCOS like features will go away, right? The next thing that is commonly asked is, what are some of the tests that we should do when we're planning a pregnancy? I think that's a thing which is on the mind of everybody. So the endocrine conditions which are more likely to occur in women, we should definitely screen for it. So on top of that list is your thyroid test. Diabetes is becoming extremely common in younger and younger individuals. So screening for your blood sugars is important. Blood pressure is also something that you should check before you plan pregnancy. It's kind of a paradox that in one way we're all gaining weight and at increased risk for diabetes, but in the same breath we're also at increased risk of anemia and low vitamin B12 and vitamin D levels. Vitamin D levels are deficient primarily because we are all getting inadequate sun exposure, but anemia could occur due to many reasons. But one important contributor is the poor nutritional quality of our meals, even in urban Indian women. So there seems to be some mismatch there, and that's also something which we must pay attention to and optimize before we plan pregnancy. So I'll go through that list again. First would be probably check your height and weight and your BMI and try and optimize that before you plan pregnancy. Second, thyroid levels. Third, sugar levels. Four, hemoglobin levels. And fifth, your blood pressure levels. This is so that we can be completely clear and aware and have a pregnancy with no hiccups or headaches, right? Moving next to diabetes. It was earlier believed that diabetes occurs in your 40s or 50s, type 2 diabetes, but you and I are both aware that it is affecting more and more young individuals, and women are no different. The risk factors are many. A strong family history is one. The second is the fact that we might be all leading sedentary lifestyles. Some of our eating habits might not be healthy. We might not be getting adequate sleep. We might be stressed. We might be on medications like steroids, which can increase our risk of diabetes. Certain risk factors that are specific to women are also there. Like, for example, there is a kind of diabetes which is seen only during pregnancy. It's called gestational diabetes. So if you had diabetes during your pregnancy, that is a risk factor for developing type 2 diabetes in the future. For some, it could be 5 years. For some, it could be 10 years from the pregnancy. For some, it could be as early as 2 to 3 years. But you must clearly understand that you can reduce your risk of developing diabetes or prevent type 2 diabetes by implementing lifestyle changes right after the pregnancy if you were diagnosed with diabetes with pregnancy. PCOS is a risk factor for type 2 diabetes. That's important to know. It's important to screen for annually and keep our eyes on it. And similarly, if you have blood pressure, you're at risk for diabetes. If you have cholesterol, you're at risk for diabetes. If you gave birth to a child whose birth weight was greater than 4.1 kgs, like a large baby, that also is a risk factor for type 2 diabetes. So go through your own personal risk for type 2 diabetes. If you have any two of these, you should be getting your blood sugar checked every year. These annual health checkups are not recommended to scare you. That's not the intention. Diabetes can be prevented, and it's easier to prevent when we start early, and that's the intention behind running these annual checks. So when we catch it at an earlier stage, we know that what we are doing currently is not something that's serving our health well, and we can implement changes and make sure we can prevent it. So how can we prevent diabetes? Probably that's the question. The steps are simple. The steps are something which we already know, but what matters is to implement them on an everyday basis, sustained effort. So just like we do not become graduates or engineers or good at anything with an effort for 1 or 2 months or even 6 to 9 months, you and I both know that it takes longer duration to do that. So preventing diabetes is also a long-term game. So the earlier we start, the better it is. In fact, if you have a lot of people in your family with diabetes, you should start with the children. So all the changes that you're making should be something which we try and implement with everybody in the house, because we are all sharing genes in our body. So simple changes like healthier food choices. Close to 70 to 80% of our risk of diabetes is related to food intake. So all of us eat less vegetables than recommended. Working towards improving our vegetable consumption is an important step. All of us eat less protein than recommended. Protein comes from many sources. The vegetarian sources of protein are dal, milk, curd, paneer, soya, maybe low fat paneer. The non-vegetarian sources of protein are egg, chicken, fish. So it would make sense to increase their intake. There's a lot of hidden carbohydrates in many of the processed food which we eat on a regular basis without realizing what it is doing to our health, like the couple of biscuits that we eat in the morning with our tea and again in the evening with our tea. That is made out of processed food which can increase our sugars. The occasional bread or rusk or namkeen or fried food or fruit juices or soft drinks or chocolates and ice cream, they are all very calorie dense, energy dense. By that what I mean is a small amount of that food can lead to a large calorie intake. So those are some of the risk factors for diabetes. So targeting them in your diet will help. Some form of physical activity every day, something which you enjoy. Getting bored with exercise and physical activity is very common, very expected. So anticipate it and make provisions to keep yourself engaged. So find a friend to go on a walk with you. If you're getting bored with the walk or it's the rainy season, sign up for an online class. Find something that you really wanted to do always but never had the time. So join a dance class, join a yoga class, make it something where you go meet your friends, where your mind is relaxed while your body is exercising as well, and keep it going. It's normal to be bored after 3 months of yoga class. You might probably need to join something else. Keep it interesting and be kind to yourself. We tend to worry a lot, and stress is an important contributor of type 2 diabetes. Know that we can't change mostly anybody in life except how we react to the situation, and that is absolutely in our control. So try and pay attention to situations which increase your agitation, aggravate your mood. Find out why that is happening, figure out if that situation can be solved or not solved. If it cannot be solved, try and detach yourself and provide yourself the tools to regulate your emotions, because they are a huge contributor to metabolic disease. I want to spend 2 minutes talking about heart disease in women. Generally, it is believed that estrogen protects women from heart disease. It might be true, but in today's world it might not be so true at all, because there are a number of variables that have changed this. For example, equal number of women have diabetes, and if you have diabetes, that is a risk factor for heart disease. So we can no longer be complacent saying that estrogen is going to protect us from heart disease, and stress is an important contributor to heart disease. Apart from this, there are a new set of risk factors which have been identified for women. which are called gender specific risk factors for heart disease, right? So we go through certain changes in our body as part of our normal life, uh, which haven't traditionally been studied and paid attention to. But there is now increasing evidence to suggest that, let us say you had diabetes detected during pregnancy, that can be a risk factor for heart disease in the future. Let us say you had pregnancy related hypertension, that can be a risk factor for heart disease in the future. Let us say during menopause you had hot flashes, right? Where you're suddenly feeling warm and sweating suddenly. They're called vasomotor symptoms. That can be a risk factor for heart disease in the future. So these are new factors which have been identified. So when your doctor is paying attention to your risk for heart disease, every doctor will do that. When you go for your annual health checkup, let them know whether your pregnancy was all right, or did you have diabetes or hypertension, or did you have a baby who was underweight. Did you know that having a baby who's underweight is a risk factor for your heart health? So pay attention to all of these, write down these things and discuss it with your doctor. We have many ways in which we can reduce our risk. There is evidence to suggest that women are not likely to receive all the preventive measures which are available for heart disease, because in some way there is a bias amongst healthcare professionals which is implicit or maybe subconscious, which doesn't get them to give us all the protection. So be proactive and ask, what are my risk factors for heart disease? What should I be doing to prevent it? Are there any medications I should get on? Are there any things that I should do to prevent heart disease? And heart disease presents very differently in women as compared to men. So traditionally it's described that heart disease comes on in men as a sharp, heavy pain in the middle of the chest, can radiate to your shoulder, left side, left jaw, back, associated with sweating. Whereas heart disease in women rarely presents like this. It presents very differently. It could just present as feeling weak. I don't feel like myself. I just feel like lying down today. I feel like I have indigestion today. I feel like I'm burping a lot more today. These are very non-specific, vague symptoms, very likely to be deemed as, oh, it must be gastritis. So I tell all women that no age is protected from heart disease. If you have any vague symptom related to your chest, upper back, and if you have one or two risk factors for heart disease, don't waste time. Go to the closest hospital and get it tested. They'll take an ECG, they'll run a few blood tests, the reports of which should be available within the next 20 to 30 minutes, with which we can clearly rule out a heart attack, right? And they might sometimes ask you to stay on or come back in 6 hours for a repeat ECG and a repeat test. It's as simple as that to detect heart disease. And it's truly life-changing and life-altering. So women are as much at risk for heart disease than men. Keep that in mind. And with the heart, every minute matters. So if you're in doubt, go ahead and get it tested. It's just a matter of a ECG and a simple blood test. Okay? I'm going to spend 2 or 3 minutes talking about menopause. Menopause is the normal physiological transition which all women go through, where the ovarian functions slowly come down and there is cessation of periods or menses. It's an important transition because the hormone estrogen levels come down and the hormone FSH, which is the hormone produced by the pituitary, goes up. So just like around puberty there were a lot of changes that your body experienced, you can expect similar changes around this time. So you might see fluctuations in your weight, you might see fluctuations in your mood, you might experience hot flashes like I said, you can experience maybe a surge in anxiety, or mood instability, and also maybe sleep disorders. There can also be aches and pains. This transition window is important to pay attention to because sometimes for some women it can be turbulent enough which can maybe precipitate the diagnosis of hypertension or diabetes or cholesterol. So if you have any symptoms like this, including having, let us say, discomfort while passing urine, a burning sensation while passing urine, or difficulty during sexual activity, please reach out to your doctor. There are solutions to all of these which you experience. These symptoms are extremely common. We've just concluded a study where close to 2/3 of women experience urogenital symptoms around menopause. Close to 30 to 40% of women experience mood instability and also body aches and pains. So there are solutions available. There are parameters that we can optimize so that you can tide through this without it rocking the boat too hard. So it's important to also screen yourself for metabolic conditions around this time. And throughout, it's also important to pay attention to the cancer screening. I'm not going to be able to brief on that in view of the time. The last bit I want to talk about is osteoporosis or bone health. Because there is a sudden drop in estrogen level around menopause in women, estrogen is a hormone which protects our bones. So when the estrogen levels are down from our 50s onwards, there's a steady decline in the bone strength, which essentially means that our risk for fractures keep increasing. So what this essentially means is that, let us say there's a fall, a simple fall. You could just trip on your stairs, slip in the bathroom. Just these slight falls could result in a fracture, and the most common areas which are affected in osteoporosis are fractures related to the hip. You might have heard that happening, or it could be a fracture in the spine, right? Now, both of these conditions are important to recognize because it's easily preventable. Second, if you have fractures in your spine, it can restrict the ability to which your lungs can expand. It can also affect your posture. Your backs can be hunched forward. If you recall, you might have seen elderly women in your childhood who were hunched back completely. They were hunched back because their bones had become very, very weak and they are compressed onto themselves. Those are fractures. A fracture to the hip means you really cannot bear weight on that leg, which means you cannot walk. That by itself is an important risk factor for being bedridden, which essentially would mean there's an increased risk of bed sores, there's low well-being, increased risk of clots in the veins in your legs called venous thrombosis, and a 50% increased risk of mortality or losing the patient after a hip fracture. So we can screen for your bone strength. It's recommended that women over the age of 65 years get their bones screened for osteoporosis, and we have medications to strengthen your bones and also to reduce the risk of fractures. Men should also be screened, men more than 70 years. But women less than 65 years also should get screened if they have one or two additional risk factors for osteoporosis. And those risk factors are, let us say, you received steroids for some condition, or you're on long-standing treatment for diabetes, or you had a menopause which was very early, let's say in your 40s or 30s, or you're on treatment for rheumatoid arthritis or any other long-standing condition. So if you're going to meet your doctor for your general health checkup, ask her, how can I protect my bones? Women are more predisposed to osteoporotic fractures than men, so it's important for us to be proactive and ask for these treatments. Doctors can sometimes be hesitant to provide all the preventive measures that should be offered to you, primarily because sometimes they might wonder if you would think that they are ordering more tests than required. But if you're aware you can play an active role in the management of your health and also in prevention of many of these endocrine conditions which are more common in women. Embracing equity means catching up for all the years where we didn't have the agency to direct our health care, and we do that by proactively seeking information, raising health awareness, also spreading the word to our near and dear ones, and also asking for more from our healthcare providers to bring down the bias in healthcare against women. I wish everybody a very happy International Women's Day month, and I'm hoping that you take 20% of your energy and time, maybe 20% is too much in terms of time, but at least take 20% of your energy and invest it right back at yourself so that you can come back and be stronger, because there's no way we can continue to take care of the people that we love if no one's taking care of us. And who best to take care of us other than us? So I want all the women to go back with an intention to care for themselves better first, and there's no sin in that. It's not selfish at all. Self-care is norm. Take care of yourself, and then we'll be around long enough to take care of everybody else. I see that there are no questions except a comment. I don't know if I've missed the questions, but thank you for joining in. You can leave the questions in, maybe I could come back to answer it in another video.